Hello, friends. This is Maria Trusa, the CEO of Fort May Medical Center. Health Talk with Maria Trusa. So we are very happy to be here today. With me, I have Dr. Torres, our internist. And we have chosen the topic of high blood pressure for this week. Many of you might know that this month, actually, the month of May, is the Health Blood Pressure Awareness Education Month. So we have chosen this week and this month to speak about high blood pressure. So Dr. Torres is going to talk about the importance of understanding the consequences of having high blood pressure. Hello, Dr. Torres. Can you talk to our public in reference to what are the consequences of having high blood pressure?
Well, high blood pressure can cause quite a few problems. The most important ones are heart attacks and stroke. But other than that, there's other problems because blood pressure affects all the organs of the body. So the kidneys could be involved, the liver could be involved. And in that sense, you know, it's more of a systemic problem.
Wow. And what do you consider a high blood pressure? What are the numbers?
Well, classically, blood pressure is 140 systolic and 90 diastolic. But in recent years, they've been talking about bringing those numbers down because the lower the numbers, the less risk there are for strokes and heart attacks.
Wow. One of the things that I know that some people have the assumption, they think that if I'm not overweight, that I don't have the risk of having high blood pressure. Is that the case?
Not always. You could be, trim and fit, but come from a family where, the genetics are that everybody in the family has problems with the heart attacks, high cholesterol. So, you're not specifically clear if you're, in the right weight category. What is important is that you should be checked. That is really the key. Also your diet has a play in it too. So depending on what you eat, your pressure can go up as well. Like
people say, if you eat a lot of salt.
Yeah, salt is the biggie. Salt, sugar, fat, the three big ones.
Wow. We, as Dr. Torres was mentioning, you should be checking your blood pressure. And if you're not feeling well, if people have headaches, I know some people talk about if you have a headache, is that a sign that maybe you should check your blood pressure? I know that it's not going to be always, but what do you think?
Well, headaches is one of the symptoms of high blood pressure. Now, headaches could be, a dull ache as opposed to a throbbing kind of pain. So, you have to understand that if you're having a headache, depending on how severe it is, maybe checking your blood pressure would be the most prudent thing to do.
So this month, we've decided, as you know, we are really committed to making a difference in our community. And we have decided to give blood pressure checks for free. So we are inviting you to come here and check your blood pressure. You don't have to pay. You don't have to make an appointment. All you have to do is show up. We're open until 9 o'clock every Monday through Friday, and we're open on the weekends. So whenever you want, if you feel like stopping by and having us check your blood pressure, we are delighted to do that. So we want to thank you for listening to us today, and we want to thank you for your commitment. Take care. Thank you, Dr. Torres.